Hello, I'm Dr. Rajeshwari Rapata, and I'm going to tell you about the autism spectrum disorder. So, what is this autism spectrum disorder? Autism is generally considered as spectrum because it is different for every autistic person. Some autistic persons might need more support than the others to live their lives. You'll find that the symptoms vary from each and other individual. So different symptoms for different, and there is a certain autistic uh, assessment scale, which from which one can understand the rate of their symptoms. So when should you get your child evaluated for autism or ASD? Generally, when patients come to me, their parents, they come with their child who is already grown to 5 to 6 years old and they're worried about his behavior or her behavior. And how to understand this behavior very early, because coming with the child at 5 to 6 years, till then they could have taken the advice of the doctor, got the child assessed for his symptoms, and have got the medical treatment at the early stage. So how could one get aware of the symptoms? If you notice that the baby is not babbling by 9 months, if there is no pointing or gestures by 12 months. But the baby usually by 12 months points the fingers, shows, and does some kind of gestures. So, assessing that, understanding that is very important. Not responding to their name by 12 months of age. So, if you call the baby by the name, the baby should be able to respond. There is no single word utterance by 16 months. So usually baby calls ma, ba. So these kind of words the baby should be able to utter by 16 months. There is lack of pretend play by 18 months. So this kind of pretend play is usually done by 18 months. You can see the baby doing the pretend play. No two-word phrases by 24 months. So by 24 months, the baby utters mama, baba, such kind of words. So you will notice that if the baby is not uttering the two-word phrases, it is again a word of caution. There is loss of language or social skills. The baby is not able to understand the language, not able to speak the language. There is no interaction socially, and there is no eye contact with the people. The baby becomes very shy or avoids the eye contact. It's again a word of caution. The baby, the child, bangs his head, or also sometimes demonstrates some kind of self-injurious behavior. There can be a kind of aggression which is seen regularly, repetitively. Then again, it's a word of caution. Sometimes you'll find the child demonstrates unusually repetitive behavior like clapping the hands or doing the scratching on the fingers or blinking the eyes or repeating some words. So this kind of repetitive behaviors, okay, is again a word of caution. You need to understand that there is something wrong with the baby, and then you need to seek the assessment and getting clinically diagnosed about this condition. Sometimes the baby plays with a toy, repeatedly bangs it up and down, turns the car up and down, or sometimes you'll find if a baby girl is there, she'll take a bangle and turn it round and round, and this kind of repetitive behavior is always there. So this has to be noticed particularly. This autism diagnosis, it is usually clinical, but certain special tools are there like childhood autism rating scale, and there is an Indian scale for autism assessment as well, ISAA, which are available that helps in diagnosing the autism. And when you diagnose it, it assesses the severity of the condition and also differentiates it from other developmental disorders. It is documented and the baby is evaluated using the Indian scale of autism assessment. Now, during the initial consultation in the homeopathic case taking, we usually ask the baby's mother's pregnancy history, the family history, and all the symptoms of the mother as well as baby are noted right from the beginning. And along with it, a quantitative assessment of the child is done, or if it is already done, that is seen and the reports are evaluated. And this kind of thing is done every 3 months. And the homeopathic constitutional remedy as well as the miasmatic remedy is found out, and the baby is given the homeopathic treatment. Homeopathy works very well in cases of autism as well as ADHD. So whenever you notice these symptoms in a baby, you should be cautious and need to seek a doctor's advice very soon and get the assessment done. And you can avail the homeopathic treatment at our place. Thank you.